The number of young people having to wait more than a year for NHS mental health support has more than doubled in the last year, according to official figures. More than 200 children and young people were still waiting to be seen for treatment after 12 months, and thousands are waiting for longer than they should. Meanwhile, while 1 in 5 of those referred to child and adolescent mental health services, CAMHS, are turned down. 9 out of 14 health boards fail to meet the Scottish Government's target of treating 90% of those referred within 18 weeks, according to the latest waiting times figures. Children's organisations said transformational change was needed, describing Scotland's mental health crisis as an epidemic which often begins in the teenage years. NHS boards failing to meet the 18-week target of Fife, Grampian, Highland, Lanarkshire, Lothian, Tayside, Ayrshire and Arran, Greater Glasgow and Clyde Valley and Forth Valley. The Scottish Children's Services Coalition, SCSC, an alliance made up of private and voluntary sector children's service providers, said only 0.56% of NHS Scotland's expenditure goes to fund CAMHS and that youth services make up less than 7% of the mental health budget. However, 50% of mental health problems are established by the age of 14 and 75% by the age of 24.5, the coalition claims. SCSC is calling for an urgent focus on prevention and early intervention and a major increase in investment in mental health services. It also said the Scottish Government should address a postcode lottery for mental health treatment across the country. Although the 2018 programme for government announced an additional £250 million of funding, the coalition said more investment was still needed. Meanwhile, it said many of the 21.9% of young people who were rejected for treatment had no real understanding of should happen next. It said effective early intervention services such as school-based resilience classes and better training for education staff could reduce the need for referral to under-pressure specialist CAMHS. A spokesperson for the SCSC said, "We are continuing to fail thousands of children and young people with mental health problems, with more clearly needing to be done to address this epidemic." These newly released figures highlight that the NHS in Scotland, including 9 of our health boards, are failing to meet what is already a lengthy waiting time. Yet we know that 3 children in every classroom has a clinically diagnosable mental health problem. There must be a radical transformation of our mental health services, with a focus on preventing such problems arising in the first place and intervening early, especially when we know that half of all mental health problems begin before the age of 14. This includes For more on this story, visit the news article link.